welcome Dr. Pfeifer from Cornell. How are you doing today?
I am fine. It's good to see you.
You too. Thank you so much for joining us. We've got lots to talk about. So first of all, I'd love you to introduce yourself to everyone watching, and then we can talk about ways to optimize time at home to your advantage during downtime of COVID-19.
That's right. Amazing that we're in this situation. So I'm Samantha Pfeifer. I am a reproductive endocrinology infertility specialist practicing in New York City at Weill Cornell. I'm also have a strong affiliation with the American Society of Reproductive Medicine. I've been the chair of the practice committee in the past. I've been the president of the Society of Reproductive Surgeons, and I'm currently on the board of the American Society of Reproductive Medicine. So I wear a lot of hats in being involved with fertility care.
Well, we're lucky to have you today, so thank you so much for your time.
It's my pleasure.
So obviously it's a very crazy situation all over the world, but very much so in New York. As we know, Cornell is currently shut in terms of being able to do treatment, as many other people around the world are being affected by not having their treatment at the moment. So it would be really good to understand ways in which people can perhaps optimize their health and their well-being during this time, so that they feel prepared for when clinics reopen.
Yep. No, I think it's really important. I think, the world was sort of broadsided by this pandemic, and many comparisons have been made to the Spanish flu of 1918 and the virulence and the death relating to this, and young people. And so I think it's really hard when you have a plan. My patients have expressed this: I've got a plan, this is my timeline to get pregnant, and all of a sudden I've been derailed from this. And I think it's very frustrating to suddenly have your plan altered. I think the only thing to think about is it's something that was unexpected, unanticipated, and this didn't just affect fertility patients. There's a lot of other patients out there, patients who had a recent diagnosis of cancer who couldn't pursue their definitive surgical treatment or chemotherapy or organ transplants, or just people needing surgery for, whatever, orthopedic issues. So I think it's really just really affected everyone tremendously. And it's been very challenging as a physician to take care of patients when you really cannot proceed and help them in the timeline that was anticipated. And so, we're all in the same boat together. And as someone once said, we will get through this together, we'll be stronger after this. So I think that it's very difficult. I think that because most clinics are closed due to the pandemic and, risk of spreading disease and the intent of flattening the curve and things like that, there's some things to do while we're down. What can we do to really make good use of this time? And how can we keep ourselves healthy, both physically and mentally? And those things, I think, are important. They're important to prepare for when clinics reopen and we can sort of start treating people again effectively, which should be pretty soon, actually. That's the good news. So I think that, while we don't have anything actively to do, what can we do? So I kind of think of it in a couple ways. First of all, how to maintain health and keep people healthy at home and keep your body and mind in a good shape. And so one of the things that we focus on is having a schedule. Many people are all of a sudden at home doing nothing, and it's you don't even know what day it is. So it's another day. I wake up and I go from my day pajamas to my night pajamas to my day pajamas again. It's kind of frustrating every day.
Yeah, suddenly we're nearly in May.
I know, it's crazy. But it's actually been 7 weeks since this whole thing really started. It's sort of amazing we've lasted this long. But I think having a schedule and making sure that you get exercise. If you get exercise and your body is getting, you get moving around, and that's important, and eating well and focusing on good food and not eating, bad food. And I think those things are important. Getting enough sleep at night, focusing on relaxation techniques, things to keep your mind in a good place are really important. And doing things that help calm you, whether it's exercise, relaxation, those things are important to keep your body and mind in a good shape. And so that's the baseline, I think, what we all need to do, especially people that are preparing to start treatment when we return.
And that would be the same advice, obviously, for men and women.
Absolutely. I think it's important, really it is. We always, I'm a gynecologist, so I always focus on the care of women. My husband's a urologist, and I always forget about, oh yeah, the men are included in this too. And it's a good reminder. I always think of fertility treatment or fertility as a team sport. And no matter what aspect, it's always important really to take care of the men, and the men and women are a team. Or if it's a same-sex couple, the two partners are a team, and it's important to remember that both people are equally involved in this endeavor. So you're right, the partners always need to be included as well.
100%, 100%. And what you say is so important in terms of, obviously, from a physical point of view, keeping up the exercise, watching what you eat, and just making healthy choices, and exercise if you can, whatever you can do from home. Obviously, not everyone has outdoor space, but also, as you said, keeping your mind healthy. So speaking to loved ones, getting the support that you would have when you were going through this before we weren't able to see people. And as you said, whether that's mindfulness or visualizations or enough sleep, things that make you happy and make you feel like you will get through this, and things will normalize to a degree in time. So just to hold on tight and keep positive, I guess.
Also reaching out to people. I think that that's something that has been actually refreshing during this time. Living in New York, I've had many people reach out to me, just say, hey, how are you? And it's a reminder that, having connections, having friends and who are supportive, maybe not for, a fertility endeavor, but just in life. And so I think that helps you stay sane during this whole crisis that we're living through.
Funny you said that, actually, because I got a message this morning from a school friend I haven't spoken to for 8 years probably, just saying, and it was just saying, let's do a recipe swap.
Yeah.
I thought that was a really nice way to keep people connected.
I think it helps to stay healthy and calm and focused during this crazy time.
Absolutely.
Doing strange things. Yeah.
And for women who might suffer from PCOS, what are the things that they might be able to do, or for those who are still trying naturally at home, what would you advise?
So I think one of the things that life sort of is very busy for many people. Many people have a job outside the home, and then there's the home job, and it's really difficult. And people are very stressed in general. And the one thing I found in talking to patients who have been home now for 7 weeks is that they actually have time. And people have been having intercourse more frequently, just because you're home and you're not running around like crazy people doing everything that has to get done. So I think that in general, taking this time to focus on having intercourse at the right time, and having as much intercourse as possible around the time that ovulation is occurring is actually a very reasonable thing to do. And it's something that is very difficult when work is in schedule and lives are very busy. So I've had actually a lot of people get pregnant this break because they've actually been home and had time to have intercourse, and their partners are not traveling and such. So one of the things is just making sure that you take the time to have intercourse, every other day leading up to for the week or so leading up to the day of ovulation. So that's a really important thing that you can do while you're home. I think people always worry, we don't know.
Every other day.
Sorry.
Every day.
Every other day, that's a recommendation. I think that to tell someone you have to have sex every day is really daunting. And for most people, that can be very difficult.
Yeah.
So I think to have intercourse every other day certainly is a very reasonable thing. We know that the frequency of intercourse can correlate with sperm quality. If couples have not had intercourse for a long time, then the sperm may not be as good quality. There can be some potentially effect on DNA fragmentation of the sperm. And so having fresh sperm with a recent ejaculate is very important. So having intercourse several times leading up to the day of ovulation, you have a better chance of having potentially healthier sperm at that time. So that's a recommendation that I think is a very valid one, and can be done sometimes more easily when people are at home. Of course, I've had my some of my patients have said to me, "But I'm living at my parents' house. I don't know if I can have sex that frequently at my parents' house." I'm like, "Oh my gosh, I think you can. We'll figure it out." But so, things like that are important, I think, and so I think that that's one of the things we can do. And some people, sometimes ovulation predictor kits can be helpful in timing when ovulation happens. I think it's important to have intercourse well before the kit turns positive and not use the kit as to say, okay, this is when I should start. Again, for sperm quality and things of that nature. You mentioned women with PCOS. If women have PCOS, then sometimes ovulation doesn't occur on a regular basis. It's really hard to judge when ovulation is happening. I think for those individuals, sometimes using an ovulation kit can be predictor can be helpful. I think that basal body temperature charts was another method to assess that. The problem with basal body temperature charts is that they really tell you when you have ovulated, not when you're going to ovulate. And so it can be very difficult to judge that in women who are having difficulty ovulating. I think for women who may not be ovulating on a regular basis, sometimes medications can be helpful to induce ovulation. And this is a discussion that one must have with their doctor about whether or not they advise getting pregnant during this COVID time. I think we have concerns about what is the impact of COVID on pregnancy. We don't really know that impact at this point, but that's one of the concerns. I think if there's a low likelihood of becoming sick with COVID, then getting pregnant is certainly an option, and just making sure you really reduce the chance of getting sick. But if that is the if the individual has and speaking with the doctor, they have no qualms about doing that, sometimes medication can be helpful to induce ovulation without bringing people back into the office to monitor. So things that can be utilized would be metformin as a medication. It's a diabetic drug, but it has an off-label indication to treat ovulation disorders with PCOS, and that's one option. It's not a fertility drug, but it can help to regulate cycles. And I think letrozole is another medication that is a fertility drug, and that can be utilized to facilitate ovulation. And sometimes in women with polycystic ovary syndrome, whose cycles may not be perfectly regular, letrozole or even Clomid can actually induce ovulation in a more timely fashion. And very often ovulation predictor kits can actually be effective in monitoring when ovulation happens. So that's a way that people can stimulate ovulation without necessarily having to go into the office to be monitored. Mm-hmm. That's another option that people may have, and they can speak to a doctor about that.
So could people potentially speak to a doctor about starting medication to help with ovulation at this time, or is that something that needs to be done in person?
That's it's a tough one to answer. I think typically if women are under the care of a physician, that may be an option that they can try, or if they've used the medication with success in the past, then it may be appropriate to prescribe that medication. It's very difficult to say, that everyone should take this you really need to make sure you're treating the correct condition. So, in individuals who I have seen and are currently under my care, there's many of them that I feel very comfortable giving the medication, saying, what, we can't pursue XYZ treatment, but in the meantime, at least if we can get you to ovulate and you can have intercourse, you may be able to get pregnant on your own during this time. So that is a method that certainly can be useful. It's probably not a method that you can just call up and say, let me give you some of this medication. You need to make sure it's being prescribed appropriately. Because there's many reasons why people have irregular menstrual cycles. You wouldn't want to prescribe the wrong medication. But if you've been seen by a physician, have a confirmed diagnosis of PCOS, and clearly you're not ovulating reliably, this can be a method that you could speak to your doctor about.
Okay, that's great, thank you. And for those who are at home concerned that time isn't on their side, and with the uncertainty of not knowing when things are gonna restart, any advice you could give in terms of people worrying about egg quality or age, things like that?
I think that's a big concern. I mean, we're very concerned about that as well. I think, again, if you have a plan of when you want to do things, and then all of a sudden that plan is disrupted, for some people that's a serious concern. So individuals who are older, who have a lower ovarian reserve, who are facing um, needing to surgery for removal of ovaries or anything of that nature, those people certainly would benefit from getting treated sooner rather than later. So I think what we know from some good data is that waiting 3 months really should not have a big impact on success. And so I think I would be reassured by that. But certainly as we gear up to begin again, that's one of our concerns is, prioritizing starting up, and how can we get the people who medically would most benefit from being treated sooner rather than later. Um, to prioritize those individuals should probably be in the first wave of people treated. I think that I think the concern is always, well, what if I'm left behind? What if I'm forgotten? And could it be for 18 months before I'm able to go on my IVF treatment? And I think that that's one of the issues that we as providers really are concerned about. Certainly everyone is important, and everyone getting started as soon as we can is important. But I think we envision getting back and treating people in a timely fashion, but certainly some people would benefit from being started sooner rather than later. But I think that certainly, 3 months should not cause a significant change in outcome. And I say that to be reassuring. I know that for some women, every second that goes by is like, oh, my eggs are disappearing. And so I say that to sort of to help as we navigate this crisis. But also because of this, we are all so committed to getting back and getting started again. Just like any other specialty, we really need to take care of our patients, and it is difficult to wait. So those are things we are committed to as well. We're on the same page as that.
I remember having that with treatment. It wasn't during the COVID era, but in terms of, you have a date that you're working towards, and then you think, wow, if I get pregnant, the baby would be due then, and your mind starts to run away. So that's something that readers are obviously finding really difficult in the community. Is kind of, maybe they thought they might have a baby in 2020, and suddenly that's all shifting, and it's just like when and how. But everything you've said is reassuring, and fingers crossed things will start to improve and reopen soon.
I think as the virus the curve is flattened, as we say in America. I don't know if you guys say that in England, but in America it's all about flattening the curve. And as the curve is being flattened, I think that there's ways we are thinking about starting up again, and the sooner we can get up and going, the better. I think it's going to be a very different world with COVID. I mean, the social distancing and all of the precautions we've taken to squash the virus spread are going to continue, because we don't want to be, reinfecting people and having people sick again. So, but the challenge and what we're gearing up for is refiguring how we take care of patients in such a way that we can be safe. It's probably going to involve a lot of video visits for people that don't need to be seen in the office. A lot of what we do involves actually doing exams on people, whether it's ultrasounds or medication and getting blood work and things of that nature. But anything we can do without that needing those services, that video chat is what we're utilizing here in the States, because you can effectively plan treatments and get things going and minimize the time the patients are in the office, which is ideal. So it's going to be a new world, but it's a challenge, and we are gearing up to take on this whole system, which is great. I remember when we used to use only paper charts, and someone said we should use computerized charts. Like, it'll never work. It'll never happen. We'll never be able to do that. And
Look at it now. Yeah.
yeah, can't
Yeah.
function without the computer. So, I mean, there's different ways of thinking how to deliver the good care in a safe, COVID safe manner. And that's what everyone's gearing up to do. I mean, we're going to get it done. So I feel very confident that we will be up and getting people treated in a timely fashion. And as I said, it's really only been about 7 weeks since we shut down. And it seems like an eternity, but I think the concern about, oh, is it going to be 6 months to a year before we can start taking care of patients? I think that's really not likely to happen. I think it's going to be pretty soon. So very much looking forward to getting back on the horse.
That's really, really reassuring to hear. So thank you so much for your time today.
Welcome. It's my pleasure.
Thank you.